So public health's primary mission is to ensure the health and safety of our airmen, and we do that in a couple of different ways. The first is to identify risks and communicate those risks to commanders and to their leadership so that they can take action and control it. The second is to educate our members so that they can take action on their own and prevent disease and illness in their own life. Public health basically touches almost every program that the wing has. We're covering anything from the food that you eat in the DFAC to the risks that are in your shop. We are part of your deployment process and fetal protection if you happen to be female and become pregnant. We are doing your audiograms when you come in for those. And we're also making sure that you're just medically ready to be part of the Guard. The most important thing that an airman can do when they come to base is to wear a face mask and to wash their hands and maintain social distancing. COVID has been a huge challenge for us as public health. A big part of that is because it's an emerging disease, and even though it's very similar in a lot of ways to diseases that we're familiar with, like the common cold or the flu, its transmission looks so different, and we just don't know for sure all of the different ways that things are happening. The first thing that we do is we reach out to that member and get information about who they were with, and that interview takes about somewhere between 20 minutes to 45 minutes. We're really trying to dig in deep to all of the processes and things that that member had been doing, and we're also doing that for our state workers, just in case they had contact with our members as well. The next thing that we do is we reach back out to the members' unit leadership or the close contacts leadership and have a conversation and inform them that a positive case was identified on the base and these people were identified as close contacts. That allows us to send those members home and to get them on a quarantine status if it applies. Identifying those people who maybe had minor contacts but will not be sent home. Those people likely aren't going to be contacted directly by public health, but will likely be informed by their unit leadership. It's incredibly important that our airmen remember that the mission that they do here is so important. The world doesn't stop just because COVID is present. And so the steps that they take are incredibly important in preventing the spread of the disease and keeping our mission going forward.